I do have a few announcements before we have our next engaging and lovely speaker. First thing we forgot to tell you this morning is your name tag is also a flash drive. So, value added. So, all of the PowerPoint presentations for all the workshops and the plenaries are on this flash drive if we receive them in time. If they were a little bitsy late, then they'll be on the NRC for Adoption website along with, you see we're taping all the plenaries. So if you have people back in your state that you want them to come on and see, oh, we had this really great presentation, we want you to see it, it will be up as soon as they can get it edited and up. But please don't get rid of your name tag when you leave because it is a flash drive. Another announcement is regarding those great PSAs and we're so glad that you enjoyed those PSAs, and again those were TV, radio, as well as web banners. And so when it was actually, they were showing the web banners at the same time that they were playing the radio. I know that was a little bit confusing. Anyway, those are all going to be sent to everyone who's here. We wanted to tell you that the camping TV ad will also be in Spanish. So we wanted to bring that to your attention. And we've also listened to you over the years. You've said, we wish we could localize these TV ads a little bit. So what they're going to do, make available, is that they're going to put on the media version. If you want the media version, you can order those from the Ad Council directly, and they'll put a version on there if you are already working with a TV station and you want to be able to put your logo and the name of your organization. You'll be able to do that. We don't want to put local phone numbers on there because we track all the calls that come in through Adopt Us Kids, and we send them to your state or local organization. But we do want to give you the ability to localize. I also have an announcement on one of the workshops. We have a workshop update, breaking news. Workshop F on placement stability is really going to focus on educational stability. And this is coordinated by the National Resource Center for Child Welfare Data and Technology, and will include presentations by Dr. Penny Mesa and 3 state representatives. And again, they will be focusing on educational stability. That's Workshop F coming up. So I think that's all of our announcements. And now I'm happy to introduce you to, I'm the National Adoption Specialist. I seemed to forget that this morning, so I just wanted to mention that. And so I wanted to introduce you to Roshonda Shoulders, who's a newer member of our team at the Children's Bureau. We're so happy to have you on board. Roshonda's going to tell you what her title is and who she oversees as FPO, and introduce our next speaker. So thank you.
Good afternoon again, everyone, and I want to echo what Heidi said. It was a fabulous luncheon, and I know sometimes you get a little tired after lunch because it was a lot to eat, and that dessert was great, but I know the next presentation is one that we are definitely all interested in. And so again, I want to introduce myself. My name is Roshonda Shoulders, and I am the in-home Federal Project Officer, and some of the in-home folks are over here, and they would like, after this session, if some of the in-home managers could just come over here, introduce yourself to myself and just everyone that's from in-home. So it is my pleasure, for sure, to introduce to you our first general session, which is HR 6893, Fostering Connections to Success and Increasing Adoption Act. This session is being presented by lovely Miss Elizabeth Sharp, who is a member of our Division of Policy at the Children's Bureau, and where she develops policy, she also interprets policy and regulations related to 4E and 4B of the Social Security Act, plus the Child Abuse Prevention and Treatment Act, known as CAPTA. She is currently focusing on implementation work around fostering connection, and that is a huge job. So we commend her for sure in taking on this task. Ms. Sharp joined the Policy Division in 2007 as a Presidential Management Fellow after graduating from Northwestern University School of Law. She brings a lot of expertise to the Children's Bureau. In terms of child welfare, she has been a student at the Cook County Juvenile Court Clinic as an intern and at the International Center for Missing and Exploited Children. So it is, again, a pleasure for me to introduce Elizabeth Sharp, who will present the session to you.
Hello, thank you very much. Can everyone hear me okay? All right. If anyone needs to yawn, get over their lunch right now, stretch it out a little bit. Go ahead. It was delicious. It's a hard act to follow the Adopt Us kids, but we'll try. Today we're going to be talking about a PI that we issued. So we in policy have been working really hard on the implementation work around fostering connections over the past, I guess it's been 2 years now. We've issued some policy guidance documents on the 4E guardianship program, on 4E adoption assistance changes, and on tribal 4E. Just in July 9th, we issued a new comprehensive fostering connections program instruction. And that's going to provide guidance on some provisions of the law that we hadn't gotten to yet. So today I'm going to go over the highlights of that program instruction. And rather than doing a basics of the provision, this provision does this provision does that, I'm hoping we can look at the policy we've issued and looking forward to how these requirements are going to be implemented in the states. We'll focus on extending Title 4E adoption assistance to youth up to age 21, on the 4E GAP program, on the education and health provisions of fostering connections, some relative provisions, so keeping connections to siblings, notifying relatives, and waiving some licensing standards for relatives. The changes, the major changes to the 4E adoption assistance program, some information on 4E administrative and training costs, and then on the requirement to negotiate tribal agreements in good faith. First, I'm going to focus on the guidance we provided on the option to extend Title 4E, adoption assistance, guardianship assistance, and foster care to youth up to age 21. And as you may know, this gives states and tribes the option to elect to provide 4E to youth up to age 21 who meet certain educational and employment requirements. It's, like I said before, available to youth in foster care. It's also available to youth who were adopted after turning 16 and youth who entered into a guardianship after turning 16. So in the PI, we clarified that the Title 4E agency must apply the extension, the definition of child, up to whatever age is elected to all of the programs. So it must apply to foster care. It must be available to those children who were adopted or entered a guardianship after age 16. There's not flexibility in this area. In addition, we're encouraging 4E agencies to expand this definition up to age 21. We really want the most kids for the longest time to be able to get this assistance. So, for example, if the agency wants to extend up to age 18, over 18, up to age 21, but can't, there might be a programmatic reason for it. If that's the case, we're going to ask that you submit a description as to why the agency is choosing a lower age. Not just, we don't have money, something a little more. But we really do want you to try to push and get it extended up to age 21 for all of these programs. Moving on, I just mentioned that these kids have to meet some educational and employment conditions. But what we're doing is we're allowing the 4E agencies to design their child welfare programs to provide this extended care to youth in any of the 5 educational or employment circumstances. And in case you're unfamiliar with the specifics of the law, I'll go over these conditions right now. A youth turning 18, over age 18, may be eligible for 4E if they are completing for secondary education or a program leading to an equivalent credential. So if a child's finishing high school, taking GED classes, if they're enrolled in an institution that provides post-secondary or vocational education, so clearly full-time, part-time university or college, a vocational trade school. If a child is participating in a program or activity designed to promote or remove barriers to employment, so that could be Job Corps or some sort of resume help, job search help, any sort of program like that that the state would choose to include in that. Be employed at least 80 hours a month. So this could mean that the child is employed part-time, full-time, has a couple jobs, however the state chooses to define that, or is incapable of doing any of those due to a medical condition. And as I said before, we're giving some considerable flexibility in relation to these conditions. States could choose to design their 18 to 21 program to include 1 some or all of these conditions. They can establish specific criteria for meeting the conditions. Also determining how the agency is going to verify or obtain an assurance that the youth is meeting these conditions and or continuing to meet these conditions. For example, you have a child, they turn 18, they are eligible for foster care after age 18. Maybe you want to extend it to youth in post-secondary school, but you want to require the child to continue to provide evidence of enrollment. So there's a lot of flexibility in this area that maybe can help you design the program to better fit the state's needs. There is one exception to this, and that is if the state is choosing to include the education, the agency is going to have to consider a youth who's home on summer break or semester break to still be enrolled. And just, I also forgot to say, we'll take questions at the end. So write them down, think about them, let me know at the end. These youth who are over age 18 are still going to have to meet the removal from home criteria and the placement and care criteria associated with 4E foster care. So there are several ways that a youth could meet these criteria. Are they continuing in foster care after 18 or reentering after 18? There's a lot of options. There's a lot of flexibility for states. You have a copy of the PI, and that goes into a little more detail. Some examples would include court-ordered removal prior to age 18, a voluntary placement agreement prior to age 18, a court-ordered removal after turning 18, a voluntary placement agreement after turning 18 that the child signs, or a trial independence break in foster care. And that sort of option, if you're able to implement it, would make sort of like a trial home visit situation for a child. They age out at 18. A few months later, they realize they actually do want the help of the agency. There may be a way for them to come back in and get that 4E foster care. And as I said, Section B of the PI goes into a lot more detail on this, and you can sort of explore those options. In addition, the agency is going to have full placement and care of the child who is in foster care who is over age 18. And that could be through a VPA, through a written authorization from the youth, or from a court order. So for a youth who is over age 18 and is in foster care, Fostering Connections provides another allowable placement setting for 4E. They can still be in a foster family home, they could still be in a child care institution, but it also creates this new category, supervised independent living settings. We explained that an agency can really develop a range of living arrangements that's going to suit this child who is transitioning to independent living. These must be paired with a supervising agency or worker, but the setting doesn't necessarily have to meet the same licensing and safety standards. So this could be places such as a host home, even a college dorm, shared housing, or some sort of supervised apartment arrangement. However, if a youth is going to be placed in those more traditional settings, foster family home or child care institution, and the agency does not consider these to be supervised independent living, those same safety and licensing requirements are going to have to be met. So you can see there's a lot of flexibility. The agency could consider some of these supervised independent living or some not. And I know it varies a lot depending on the state, the area, the locality, the city, what is available. Again, here are some things that have to apply for youth who are over age 18. So if a child is going to be getting Title 4E, all of the same protections and case review requirements are going to apply in the same way. So that would include periodic reviews, permanency hearings, TPR timing requirements, monthly caseworker visits, and judicial terminations of reasonable efforts to finalize a permanency plan every 12 months for a youth who's in foster care. But agencies do have some flexibility in how they're going to apply this and design this for youth over age 18. They can focus the goal a little differently. So the goal of permanency might be independent living, so all of those discussions are really going to take place around that goal. In addition, the child could be involved in a different way. Maybe it's a less formal court setting. Maybe they have a lot more input and direction into the plan. So that's what we really mean by conducting hearings and visits and delivering services in an age-appropriate manner. Because things do change as they're turning 18, 19, 20, and moving toward that independent living goal. In addition, Fostering Connections creates a transition planning requirement as part of the case review system. And this applies to youth who are going to be receiving foster care maintenance payments after age 18, as well as those who are going to exit at age 18. So the caseworker must assist and support the youth in developing a transition plan during the 90-day period before that youth attains age 18. Whereas I said before, the older age that is elected by the agency. So the transition plan requirement still must be done before the child is leaving the system, basically, that 90-day period. It must be personalized and at the direction of the child, be as detailed as the child chooses, and include some specific options regarding housing, health insurance, healthcare proxy options, education, opportunities for mentors, continuing support services from the agency, workforce supports, and employment services. We know that there's also a chance that the child might leave foster care more than 90 days before his or her 18th birthday or the age elected by the agency. And in that case, it's not going to be required. We are expecting the agency to really prepare and fully engage the youth. We know that agencies are doing work with youth who are expected to age out well before this 90-day period. And we expect that agencies are going to continue this work. So whatever independent living process is going on before that 90-day period now should continue. And we really want agencies to look at that process, consider how it's being done, and integrate this 90-day planning period as well. Okay, now I'm going to talk about the Guardianship Assistance Program, which is an option I'm sure you've heard a lot about. It's something that's already being implemented. States are submitting their plans and getting them approved. And it is a program to provide 40 payments to children who are in the care of a relative who is the child's legal guardian. Not a requirement. This is something that agencies can choose to elect. Probably one of the biggest questions and one of the most frequent questions we received around GAP is, are you going to define relative for us? And the answer is, not quite. We're giving agencies a lot of flexibility in how they're going to define relative. So relative could mean just blood relatives, or it could also include really good friends, tribal kin, or what a state may consider to be fictive kin. However, we do encourage the agencies to have a definition that's consistent with their relative notification definition. The purpose of this is to ensure that all the relatives that could be potential guardianship caregivers are getting that notice, are getting that opportunity to become involved in the child's life. In addition, there are some eligibility criteria that must be applied to every single child. The family is going to have those criminal record checks. The family is going to the caseworker should determine that returning home or being adopted are not options for the child. You'll need to show that the child has an attachment to the guardian and that the guardian has a strong commitment to caring for that child. In addition, for children over age 14, the agency needs to consult with them about the guardianship. In addition, the Guardianship Assistance Program has to be implemented statewide or service area wide. So that's going to have to be across the state in every jurisdiction. There cannot be a phase-in in one county or something like that. We are granting the agency flexibility to design the GAP program in ways that can meet the state program needs. So for example, talking about this requirement. Under the GAP, a child must have been eligible for 4E foster care for 6 months while in the home of the prospective guardian. The agency is going to be allowed to extend that time, so there could be a 12-month requirement. Here are some more requirements for the guardianship assistance payments. The agreement must include the following terms. The agency has to include they will reimburse for total non-recurring expenses associated with obtaining guardianship up to $2,000. And a little different than adoption here, it must, if the expenses are $2,000 or greater, they must be reimbursed up to that high amount. So it must be $2,000 worth of expenses that are reimbursed. It must also state that the agreement is in effect regardless of the state or service area of residence. So if the guardian moves to another state, the original state is going to have to keep paying that guardianship assistance payment if that new state doesn't have a gap. However, agencies also have some flexibility in crafting these agreements. So here are some ways that they can maybe narrow down the population or focus it a little bit differently. They can require periodic renewals of agreements. So this is different than adoption assistance. They're able to say, you have to report back, you have to renew this agreement with us. They can adjust the amount of the guardianship assistance payment as a child ages or as their needs change. This could go up, this could go down, that's fine. They can continue the payments if the child moves out of the guardian's home to attend college or live independently. And they can also reduce gap payments when other sources of income are received by the guardian or child. So as you can see, guardianship assistance has a lot more flexibility in those areas than adoption assistance does. However, you'll see right there, a gap payment actually has to be made in order for the child to be eligible, categorically eligible for Medicaid. So unlike adoption assistance, there can't be a zero payment so the child can just get Medicaid. There has to be some amount being paid to that family for the child to become categorically eligible for Medicaid. I know this is a lot of information, by the way, and you all have a copy of the PowerPoint in your packet. It's in the blue folder, and you also have a copy of the PI. In addition to just children who meet the guardianship assistance eligibility requirements, agencies can make guardianship assistance payments on behalf of siblings of an eligible child if they're placed in the same home. The agency is going to have to still pay that $2,000 of non-recurring expenses for the sibling, but the sibling doesn't have to meet the eligibility requirements. And it doesn't matter. The sibling could go into the guardianship, the ineligible sibling could go into the guardianship before the eligible sibling, and still that eligibility would carry back to the first sibling. So again, this is really encouraging those relative connections, really encouraging the sibling groups to be placed together with that same relative. Finally, for termination of guardianship payments, the agency has to stop the payments when the guardian is no longer legally responsible for the child, or if the guardian is no longer providing support for the child. And again, there's some flexibility with the agency to monitor whether these circumstances exist and determine how they're going to, how often they're going to monitor that. Okay, next I'm going to discuss the guidance provided on the many fostering connections provisions that deal with education for children in care and health care for children in care. First, I'm going to discuss the 4E plan requirement to assure that children of compulsory school age that are receiving a 4E payment are actually attending school. As you can see, it requires the state in the 4E plan to assure that these children receiving payments are a full-time elementary or secondary student, are in an authorized independent study program, are being homeschooled. Alternatively, the agency can assure that the child has completed secondary school already or is incapable of attending school due to a documented medical condition. This allows for a variety of different schooling arrangements and, of course, has that exception if a child is for some reason unable to attend school. For a child in foster care, this is only for a child in foster care, not for children who are adopted or who are in a guardianship arrangement. The agency must regularly document and update that child's incapability to attend school in the case plan. So the agency should be updating that status whenever the case plan is updated. And this is to make sure that that monitoring that medical condition still exists so that the child is unable to attend school. So this is a pretty big requirement to make sure that all of these kids are actually attending school. But the agency is going to have discretion to determine how they're going to ensure the enrollment requirements are met and whether and how it's going to document those medical conditions for children who are adopted or who are in guardianship. At the same time, we're encouraging the agencies to work with the schools to address these barriers to enrollment, to identify experts on education to help serve as a resource to keep these kids enrolled, and to also monitor the progress of each child in the school consistent with the education case plan requirements. So again, agencies are already doing work around this area, but we want you to, with this requirement, not just ensure that you're meeting the basic assurance, but also go back, look at how things are being done, and see what can be improved now. Here's another assurance, this part of the case plan requirements for educational stability. This is an assurance that the child's initial foster care placement takes into account the appropriateness of the current school and the proximity of the school to the placement, and that the agency has either coordinated with the school to ensure the child can stay enrolled, or if the agency determines that it isn't in the child's best interest to stay in that same school, need to make an assurance that the child is immediately enrolled in a new school and that their education records go with them. And the agency has the flexibility to determine what factors are going to go into making that best interest determination. So it could be something like the old school doesn't have a certain type of special education service the child needs, but this new school closer to the placement would. It could be a safety concern, but it can't be about school transportation costs. So if it's an issue of the child can't return to their original school and it would otherwise be in their best interest to stay in that school, and the only barrier is the transportation cost, that cannot be the reason. And we'll get to that a little later because now 4E has been extended so that a foster care maintenance payment can include those costs. And these assurances relate to the time of the child's initial placement, as you can see. But we're encouraging the agency to update the plan whenever children change schools, which just makes sense. Whenever there's a placement change, whenever there's a school change, you should be looking at what is best for the child for their educational stability. And here we go. Payments for school transportation. So as part of a child's 4E foster care maintenance payment, agencies may, but are not required to, include the cost of reasonable travel for a child to remain in their same school. And this can be included whether the child's in their initial or a subsequent placement. The agency can determine what they consider to be reasonable travel as far as cost, distance, and time. And the agency has the flexibility here to either provide the payment to the child's care provider or make a separate payment. It's still included in that cost of the foster care maintenance payment directly to a transportation provider. That makes things a little simpler, a little easier for the care provider. In addition to these costs being able to be part of 4E foster care maintenance payments, transportation costs associated with the child's attendance at his or her school of origin are still allowable administrative costs under Title 4E. So they can still be claimed at that 50% rate as an administrative cost. Okay, moving from education to health care. The Healthcare Oversight and Coordination Plan is a 4B plan requirement that the state or tribal agency develop and submit a plan for general ongoing oversight and coordination of healthcare services for all children in foster care. It's not child-specific, if that makes any sense. This plan really needs to include a schedule for healthcare screenings, how medical information for children is going to be updated and shared with the appropriate people, steps to include the continuity of healthcare. So that might include something like establishing a medical home for each child, and thinking that just because they've changed placements, or even if they go home, that doesn't mean they have to change who their doctor is. It needs to include a plan for prescription drug oversight, including the use of psychotropic medications. And it should also include how the agency involved doctors and other appropriate medical experts in developing this plan. Again, we're really encouraging the agencies in developing this plan to pay particular attention to the oversight of the use of psychotropic medications in treating the mental health care needs of children. And the agency is going to be required to submit a copy of the plan and how the Medicaid agency in the state was consulted on the plan to the Children's Bureau. However, this is a big plan. The agency is going to have the flexibility to decide some factors. And again, this is something that might be already going on in your state, and this might be something you want to go back and revisit and make sure you're doing the best you can, not just to meet this requirement, but to meet the needs of the children. So you can decide how to implement the specific requirements of the plan. You might want to consider implementing a single agency-wide healthcare monitoring entity, or there could be another mechanism put into place to implement this plan. And again, for the schedules for health screenings, as long as it meets the standards of medical practice, as long as it's an accepted schedule of screenings, that's fine to include in the plan. Now I'm going to move on to provisions related to preserving connections for relatives. This includes provisions requiring some sibling placement considerations, relative notification requirements, and the option to waive non-safety licensing standards for relatives. First, I'm going to talk about the 4E plan requirement. So again, this is a 4E plan requirement, more general, to make reasonable efforts to place siblings removed from their home in the same placement for foster care, adoption, and guardianship placements. And to, if a child cannot be placed with their sibling, facilitate frequent visitation or ongoing interactions as appropriate. And there is an ability to make exceptions for when the agency determines that that placement together or the visitation is contrary to the safety and well-being of the siblings. Again, we describe in the PI where the agency may have some discretion here. They can define siblings and sibling groups. We don't do that for you. Set standards for visitation and contact, as long as it's a minimum of monthly visitation. However the standards are set in the state is fine. And determine appropriate settings and when it's appropriate supervision of visits. In addition, we're encouraging agencies to develop a standard decision-making protocol for workers to determine if it's appropriate for siblings to be placed together, to have visitation, how often that visitation should take place. In addition, the agency is encouraged to conduct periodic reassessments of the situations in which siblings are unable to be placed together or have frequent visitation. Because as you all know, these things can change. It might be inappropriate for the two siblings to be together when they're initially placed, but a few months down the road, it may be in their best interest to then be placed together. And again, this is stuff that's already being done, but it's a great idea, and we really want to encourage you to develop that specific protocol that reminds workers, do this, look back at this, take a second look. Give that other child a chance to visit with their sibling. Here's another requirement related to those connections with relatives, and this is the relative notification requirement. This requires an agency to exercise due diligence to identify and notify all adult relatives of a child's removal within 30 days of removal. As you can see, the state has the flexibility to define due diligence. In addition, there are allowable exceptions due to family or domestic violence. So the agency has discretion to determine what the exceptions should be, what the scope of all adult relatives is, and what is the method or form of notice. At the same time, we know relative notification may be going on already, but we want you to look at how that notification is being done now. How can you provide notice in multiple and innovative ways? In addition, as I mentioned before, we really like this definition of all adult relatives to be similar or the same as the definition of relative used in GAP program, so that we are identifying as many relatives as possible, not only of their ability to take care of this child, but of the availability of the guardianship assistance program. Now we'll talk about the ability for states to waive non-safety licensing standards for relatives. So an agency has discretion to, but is not required to, waive on a case-by-case basis non-safety licensing standards for relative foster family homes. Things like the number of bedrooms, the square footage of the house. States are allowed to determine what they consider to be a non-safety licensing standards, and they can also consider variances to meet licensing and approval standards. We do expect agencies to clearly document these reasons for the waivers and also indicate the specific applicability of the licensing or approval to that one relative child. So if a child is being placed in a relative home and there's a the licensing waiver, that doesn't mean that it applies to any other child that's in the home that is not related to the foster parent. In addition, we encourage agencies to look a little bit beyond this as well and use a variety of means to ensure that relatives are able to meet the standards. So consider the use of 4E administrative funds, for example, if there's something simple like they need a bed or something like that. So if you can, look past the waivers and try to actually help the family meet those standards. Okay, now moving on to 4E adoption assistance and the changes made to this. So bear with me, it's a little bit complicated, and I'm going to have to explain the actual changes as well as what guidance we've provided already here. So to give you some context, this is how adoption assistance worked before fostering connections. A child with special needs could be eligible for adoption assistance by being eligible for AFDC at initial removal. If the child was not eligible for AFDC and could not access the program through one of the other pathways, the child could not receive 4E adoption assistance. And we all know that the AFDC standard is based way back in 1996. Fostering Connections, however, gradually phases in new eligibility criteria so that by fiscal year 2018, the AFDC pathway will have been completely eliminated. Until then, there's going to be two separate sets of eligibility criteria, one based in AFDC, one with the AFDC piece eliminated. Despite that change, these requirements are going to apply to all children regardless. They'll need to have that special needs determination. There'll still need to be criminal background checks. The adoption assistance agreement is going to have to be the same and include the same items. Children are still going to be categorically eligible for Medicaid. Non-recurring expenses are going to have to be paid for these children regardless. Termination, the reasons for termination, the same. Fair hearings still need to be available for everyone. In addition, the PRORA, so the qualified alien, the citizenship requirements, are still going to apply to all children who are receiving adoption assistance. So now adoption assistance is divided into two groups of children, the applicable child and the non-applicable child. I know. So who on earth is not an applicable child? That's the child whose eligibility can still be linked to AFDC. Are there new rules that apply to these children who are not an applicable child? No. Everything's the same for them. The big question, who is an applicable child? That's a child, in general, whose 4E adoption assistance eligibility is no longer linked to the former AFDC program and for whom the entire new program rules apply. So how does a child become considered an applicable child? There's three ways. The child's age in the fiscal year that the adoption assistance is entered into, the amount of time the child's been in foster care. So a child who's been in foster care for 5 years, 60 consecutive months, is considered to be an applicable child. Or they can be the sibling of a child who's an applicable child and be placed in the same adoptive placement as the applicable child, and by meeting certain conditions at the initiation of the adoption proceedings. So basically there's three ways. The child's age, so if they're older, they meet that age requirement. They've been in care for a while, and if they're a sibling of an applicable child who's going to be placed together with them. This chart illustrates the age requirements. So as you can see, the highest age attained by the child during the fiscal year is what's going to affect whether they're considered not an applicable child or an applicable child. Right now, we're in 2011 now. So since we're in 2011, children who are 14 or older are considered an applicable child. Everyone younger is not an applicable child. And this age decreases by 2 years every fiscal year. Until 2018, we don't have to worry about it anymore. Okay, so let's talk a little bit more about the ability to have the time and care in the siblings, how that makes a child an applicable child. Okay, so we have the age. So if they're old enough, they're an applicable child. There also can be an applicable child if they've been in 4E foster care for 60 consecutive months and they're otherwise eligible. Also, as I said before, if they're the sibling of an applicable child and they're going to be placed in the same adoptive placement, they can be considered an applicable child. Now we get to the interesting stuff. So how can an applicable child actually be determined to be eligible? You know they're an applicable child, now what do you do with them? So there are 4 pathways to eligibility for adoption assistance for an applicable child. If the child meets specific criteria at the initiation of adoption proceedings. So this means a contrary to the welfare judicial determination, a voluntary placement agreement, or a voluntary relinquishment. Any of these would meet this criteria, and the child who's being adopted could then be eligible for Title IV adoption assistance. The second pathway is if a child meets all medical or disability requirements for supplemental security income at the initiation of adoption. This is different as well because it removes that income piece from the SSI determination. So as long as the child is able to meet just the medical side of it, they can be eligible for Title IV adoption assistance. The third way that a child can become eligible as an applicable child for adoption assistance, if the child is the child of a minor parent, so the child is the baby and the teen, and that parent is getting 4E foster care, and the baby, the applicable child, is living with the minor parent in a foster family home, and they were removed via a contrary to the welfare judicial termination, or a voluntary placement agreement, or a voluntary relinquishment. This basically mirrors what is already available under adoption assistance now, but instead we're talking about an applicable child and the availability of that for the child of the minor parent. In addition, again, this mirrors what's available right now under adoption assistance for all children. If the child was eligible for adoption assistance in a prior adoption, that can carry over and they will be eligible again. Now, there are a few changes to the eligibility criteria, including for international adoptions. So, for a child who is an applicable child, so this new eligibility group, even if the child has special needs, adoption assistance is not available to a child who is not a citizen or resident of the U.S. and who was adopted outside the U.S. or brought to the U.S. for the purpose of adoption. And as you probably already know, it's very rare for a child who is in an international adoption to be able to receive adoption assistance or non-recurring expenses today. And those per aura restrictions, those citizenship or qualified alien restrictions, are still in place for all children. But what this does is pretty much eliminates almost any chance that a child who is adopted from another country could get adoption assistance. And that's it for adoption assistance. Next, I'm going to talk about the requirement for states to negotiate in good faith with tribes regarding 4E agreements. And what does this really mean? It is there, required to negotiate in good faith. That's a big question we've gotten. What we're encouraging is that states and tribes work together in entering into or revising these agreements to make sure you're giving the tribal kids the same access to 4E as any other child. At a minimum, we expect that all the parties are going to have an opportunity to contribute to the development of the 4E agreement. Of course, states and tribes still have the full discretion to create the arrangements that's going to work best for all parties for the 4E agreement or contract. Finally, the PI addresses some changes changes in the availability of administrative and training costs under Title IV-E. First, I'm going to talk about short-term training. Currently, a 4E agency can claim short-term training for certain categories of people. Fostering Connections added some new categories. This includes relative guardians, members of licensed or approved child welfare agencies who are providing services to 4E kids, members of the staff members of, or the staff of abuse or neglect courts, agency attorneys, and any attorneys representing children or parents, guardians ad litem, or other court-appointed special advocates representing children. So agencies may, but don't have to, get administrative funds back for these trainings. The rate for these categories is being phased in. In 2013, it's going to be 75%. That'll be reimbursable. And again, we've got a lot of questions about this. This is not something that is directing the agency to provide training. It's opening up the availability of funds for them to provide training to these groups of people if they choose to. Okay, in general, we just talked about a lot of requirements, and there are even a lot more that we didn't even touch on today. But there is some additional funding available to implement Fostering Connections. So these administrative and training costs can be claimed for all different aspects of the program. So I've provided some examples here. Maybe you could claim administrative and training costs related to implementing that 18 and over program, because that's going to require a lot of changes. We talked about tailoring that to youth and how you're going to tailor your services and court dates and things like that to youth. Money can be claimed for that. The cost of transporting a sibling removed from his or her home to a sibling visit, if not jointly placed. So again, required to have that sibling visitation, administrative costs can be claimed for implementing this, even down to the specific level of a single sibling visiting another sibling. Again, costs can also be claimed associated with approving existing agency protocols for identifying and notifying relatives of children entering foster care. And this is what I was talking about before. Sure, you might be meeting the requirement in the basic level now, but if you want to look into it, if you want to improve how you're getting relatives notified, how you're telling them of their options to maybe get the guardianship assistance that they need to take in this child, you could look into it and claim the administrative costs associated with improving that program. This slide provides links to some of our most important resources, at least I think they're our most important resources, for implementing Fostering Connections. You should all have in your blue folder a copy of the PI. Also, attached to this copy will be a single resource on Fostering Connections implementation. This is being continuously updated. It has all of the latest guidance. You can click through, see whatever you need, and that's available on our website right there. In addition, if you really, really are interested in Fostering Connections and want to read a lot more about it and get down to the nitty-gritty, you can go visit our updated compilation of Titles 4B and 4E of the Social Security Act on our website. Okay, now time for questions, and I hope you all brought your questions. I hope you've been thinking of them, writing them down. I do want to clarify any confusion you have today if possible. Go ahead.
Hello? Okay, so you have a sibling group. One child is 14, so they are eligible, a special needs child, they're eligible for the extended Title 4E this year. Okay, they're adopted. 2 years later, you have a sibling of that child who is adopted by the same home, who is not eligible due to the, by age. Would that child be eligible categorically because it is placed with the sibling, even though the adoption does not occur at the same time of the siblings?
Okay, the answer is yes, but let me make sure one thing is clear. A child is not categorically eligible. They become an applicable child so that they don't have that financial piece. Just to make sure, they still do have to meet the adoption assistance requirements. But
Right.
yes, if that sibling is placed later under a different adoption agreement or whatever they're going to do, you could amend the original adoption assistance agreement, or you could create a new one separate for that payment, and they would still be able to receive it.
Hi, I'm Marie Young-Peter from Alabama. I just had a question about the kinship subsidy, in that it says that it can be based on the supports in the home. And I'm wondering, as long as they're supporting the children, what does that mean? Because it was different for adoption subsidy in that it could have been any kind of support from a birthday card or otherwise. What constitutes supporting a child for kinship?
And, you know, I don't think we've actually gone into that and issued guidance specific to guardianship assistance on that. But as we were saying before, there is more flexibility. So it could be that the child is even gone to college or living on their own and getting some kind of support. The state determines they're still receiving support. So it could be a wide range of support. What was that? Yes.
Hi, Elizabeth. Thank you so much for your presentation. It was excellent.
Thank you. Thanks
and
for
the
having me.
materials are terrific. Really appreciate it. So my state, as many states, are of course struggling financially.
Right.
I think it's critical that we be able to offer extended care up to age 21. So I'm thrilled that we're able to do that. Can you clarify for me if all of the 4E standards that must be met, such as monthly visits and judicial review and periodic planning and case plans, are those statutory or regulation?
I'm sorry, what do you mean, are they statutory or regulation?
Are they rooted in law, those requirements,
Yes.
or are they rooted in statute?
They are rooted
in regulation.
They are rooted in statute.
So the monthly visits, et cetera, are all rooted in statute. There's no flexibility that ACF has?
We have no flexibility to determine whether we're going to apply those or not. The way that the 18 to 21 program has been designed and the way that it was changed by Congress is to change the definition of child. Nothing else was really changed with the exception of the supervised independent living. So all across our 4E programs, the definition of child changes, but there's no flexibility for the requirements in that way. So, unfortunately,
Okay, I wish that were something that perhaps the agency could consider working with Congress on, and I'll tell you why. I can be successful in talking our legislature into letting me have the 4E match to extend care to 21. I jeopardize that option when I add the administrative cost of treating adults as children. I appreciate the fact that it's recognizing how young adults like to live and giving the options of college dorms, etc. But when you add the administrative burden and the cost of that in the current pressure that states are facing, we are shooting ourselves in the foot because legislators are not going to want to appropriate both the increased cost in care and the administrative cost of treating adults like children. Politically, that makes absolutely no sense to appropriators, and I'm afraid all of the good intents may be for naught if that is required of states, and I would encourage you and the agency to work with Congress on being a little bit more pragmatic and actually making this an option available for young adults rather than killing the possibility with undue burden and financial cost to states. Thank you.
Thank you. Thanks for your comment. And we're acutely aware. We understand that there's a lot of budget limitations and that this is going to take major legislative change in many states to extend over age 18. And I'll certainly carry that message back with me. And also, just to highlight again, we are trying to allow as much flexibility as possible so that maybe some of those hearings can take place in a more informal setting if that could save costs for the state, things like that. And we'll certainly, if anything changes, if anything's updated, if there's any additional flexibility, we will let you know. And we are available to also help and determine. So if you think, well, maybe this is one way we can meet it for a little cheaper, contact your regional office. Ask them, what do you think about this option for meeting those requirements, please? And thank you again for your comment.
I'm almost afraid to ask this question, but I guess I was just wondering if your state chooses to expand the definition from 18 to 21 and include that, does that have any impact on changing their definition of child, and does it have an impact on CAPTA in terms of now?
It would not have an impact on CAPTA because it's the definition that's provided for in 4E that we're talking about,
Okay,
not in
just that
CAPTA.
4E.
CAPTA's
Okay,
way over
good,
here,
good.
not touched.
I
We'll see what
guess
happens with CAPTA
yeah.
reauthorization
No,
if that
I
ever comes around. Then we can worry about
And
that.
it wouldn't have any impact on a state's definition of child in terms of investigating a report of a child under the age of 18, but yet you have this other population.
And that would depend on what the state chooses to do, obviously, but the state would not have to expand their definition as far as child abuse and neglect investigations.
Yeah, that was my question. Thank you.
Hi, I'm Ellen from New Jersey, and I'm hoping I'm not repeating, but I just have to have this clear. When we're talking about children being eligible because they're siblings,
Yes.
so I'm thinking in New Jersey we have a kinship program that's separate from the state.
Right.
So we may be involved with the second or third sibling.
Right.
So if I'm understanding this right, if we approved that third child for our program, which is a much It's a much higher board rate.
Okay.
We could decide to go back and loop in those other 2 children as well for the higher foster care board rate.
If you could, if you have a child who could be, if you're putting siblings together, no matter what the order of them getting into the home or getting into guardianship together, if there's one sibling there that's eligible for 4E GAP and getting 4E GAP,
Right.
then those other siblings can be eligible. Yes.
Great, thank you.
Hello? Okay. I have a couple questions.
Okay.
One is about if a kid's in a supervised setting
Yes.
and the payment goes directly to the child, is that considered income?
I think that's going to have to be an individualized question about who is asking if it's income. So I wouldn't be able to answer that right now.
And I was also wondering about like being in a Section 8 housing. And then how would you look at like SNAP programs?
I really
The
wouldn't
income
know.
verification on those?
I would not know how that would work when you're talking about the child directly receiving that payment. I'm sorry.
Okay. Thanks.
Sorry.
Good afternoon, and thank you for presenting this information. It's very valuable. I'm Ann Carver. I'm from Arizona, and this hopefully is an easy question. I just want to know if this is going to be available on the website, or if it's not on.
It should be on the USB, or it will be available on the website. Yes.
Okay, but it will be available.
Yes, it
Good.
will be available.
Good.
Absolutely.
Thank you.
That was wonderful. Thank you for lightening the mood. Oh my goodness. What I want to do right now, I don't know if anyone else has any other questions, but I'm going to put my email address up here too, so that anyone who needs it can just go ahead and has any other questions, go ahead and email me. And also, don't forget, you can always contact your ACF CV regional office with any questions about Fostering Connections implementation. We know this is a lot of information. We know that it's a lot to digest and a lot to figure out, and we're still working on it ourselves. So we want to hear from you. We want to provide you any assistance you need in getting these programs off the ground.
Thank you, Elizabeth. I'm sure all of you will agree with me that that was very helpful to have that information. And Elizabeth is going to hang around hopefully for a few minutes if you want to come up and talk to her, get her autograph, get your picture taken with her, any of that.